Alligile Syndrome by Amy Shunemann. Alligile syndrome is a disease in which an individual has fewer than normal small bile ducts in the liver. These ducts act as tubes that carry bile from the liver cells to the gallbladder, eventually draining into the small intestine. Bile is produced in the liver and has two main functions. It carries toxins and waste products out of the body, and it helps in the digestion of fats and the fat-soluble vitamins of A, D, E, and K. A depletion in the number of bile ducts causes bile to build up in the liver, which leads to liver damage and, possibly, complete liver shutdown. Damage in the liver can also lead to problems in the heart, kidneys, blood vessels, eyes, face, and skeleton. The treatment varies depending on the symptoms. Alligile usually occurs in the first 2 years of life, with 1 in 70,000 babies born with the disorder. Since Alligile is genetically linked, there are areas in the United States where it is more prevalent. Louisiana has the highest number of cases of Alligile syndrome, with Pennsylvania following closely behind. Causes. Alligile syndrome is an autosomal dominant disorder, meaning it is caused by the inheritance of a mutated gene from a parent with the disease. Children with a parent with Alligile have a 50% chance of getting it themselves. The mutated gene in Alligile syndrome is the JAG1 gene, shortened to JAG1, on chromosome 20. The JAG1 gene is responsible for making proteins that align to activate interactions called Notch signaling. Notch signaling is the communication between neighboring cells during embryonic development. It influences how cells are used to build body structures in the developing embryo, including the building of ducts in the liver. With faulty or missing ducts, bile builds up, eventually causing the development of scar tissue, which keeps the liver from being able to filter toxins from the bloodstream. These toxins cause issues in organs all over the body. Signs and symptoms. Symptoms vary greatly in cases of Alligile syndrome because the toxin-filled blood travels throughout the body, causing damage as it goes. However, some of the most common symptoms include jaundice. Jaundice can occur because bile is a reddish-yellow color due to its content of the pigment bilirubin. In Alligile syndrome, the bilirubin level is too high. Jaundice causes yellow-tinted skin and eyes. Another symptom is pruritus. Pruritus can also occur from the buildup of the bilirubin in the blood and cause itching and other skin irritation. Xanthomas are also common. Xanthomas are fatty spots that show up as yellow bumps on the skin. They occur when the levels of cholesterol in the blood are too high, which is often true in liver diseases like Alligile syndrome. Malabsorption is diarrhea due to problems in the bowel regarding the absorption of fats and fat-soluble vitamins. This can lead to poor health, bone fractures, eye problems, blood clots, and learning delays. Malabsorption occurs in Alligile syndrome because bile is not breaking down the necessary fats and vitamins. Heart murmurs can arise due to the narrowing of blood vessels, especially the pulmonary arteries. Many individuals with Alligiles have defined facial characteristics, such as deep-set eyes, a straight nose, pointed chin, and a wide forehead. Patients sometimes have an enlarged spleen because there's a lot of blood flow from the spleen to the liver. When the liver is damaged, blood flows back to the spleen, causing it to be enlarged. Abnormalities in the carotid arteries and other blood vessels are also common. 90% of people with Alligile syndrome have an unusual abnormality of the eyes, usually an extra ring around the pupil. Diagnosis. Because the syndrome is so rare and symptoms vary, the disorder can be hard to diagnose. However, if the doctor suspects Alligile syndrome, he will order the following for the patient: genetic testing to see if there are abnormalities in the JAG1 gene, blood tests to check liver function, abdominal ultrasounds to find any liver or spleen enlargement, a liver biopsy to check the number of hepatic bile ducts, an eye exam looking for any additional rings around the eye, a cardiology examination to check for heart problems and abnormalities in blood vessels, especially the carotid arteries. To render a diagnosis of Alligile syndrome, a positive liver biopsy and the presence of 3 other characteristics of the disorder must be present. Treatment. The goal of treatment for Alligile syndrome is to increase flow of bile to the liver, promote health and development, and keep individuals comfortable. Ursodiol is the only FDA-approved drug to increase the flow of bile to the liver. However, increased flow of bile may help other symptoms. All other treatment is administered to help with specific symptoms not helped by ursodiol. To treat pruritus, itching on the skin, there are many antihistamines and other drugs that can be helpful. It is also beneficial to hydrate the skin with moisturizers. If the pruritus is very severe, partial biliary diversion surgery can be done to create a tube that causes bile to flow directly out of the body. For trouble absorbing nutrients, a specific diet, pills, or direct injections containing these nutrients are administered. Liver failure is treated by liver transplant. Prognosis. The outlook for Alligile individuals varies depending on the severity of symptoms. Many who receive liver transplants have more of a likelihood of survival due to new drugs developed that suppress the immune rejection of the new organ. Many adults that are diagnosed improve from treatment and go on to lead normal, active lifestyles. Unfortunately, the outlook for children is not as good. Though research shows that 75% of children diagnosed with the disease will live to at least age 20, they will require rigorous treatment due to the fact that they missed out on absorbing critical nutrients